Hello, everyone, and welcome to CR Arthritis 2025. My name is Ellen, and I'm the Programs Coordinator at Arthritis Consumer Experts. Today, I am joined by Dr. Timothy Kowk, who will be giving a podium presentation at the conference this year titled Inequities in Fee-for-Service Remuneration Affecting Rheumatologists and Patient-Centered Care Across Canada, an environmental scan. Dr. Kwok is a rheumatologist and clinician investigator based at Sunnybrook Health Sciences Centre and the University of Toronto. And with that, thank you so much for joining us today and welcome to the program.
Thanks, Ellen, and thanks for the invite.
So, can you tell us a little bit about yourself and how you're involved in rheumatology?
So I'm a rheumatologist based out of Sunnybrook and the University of Toronto. My clinical interests are mainly in gout and crystalline arthropathies, but I also dedicate a significant portion of my time on clinical research, focusing on administrative databases and quality of care assessment, predominantly in gout. I also have a research portfolio on access to care in rheumatology services. And lastly, I also focus on inflammatory arthritis.
Excellent. Before the program started, I was just admiring how your program has really expanded in the last several years as we followed your work. So I'm very excited to kind of dig a little bit deeper into the areas that have expanded. So to set the stage for, us talking about this presentation that you'll be giving, can you, for our audience, clarify or share with us what does this fee for service in healthcare settings, what does that mean?
Yeah, so that's a great question. In Canada, the vast majority of physicians are funded through a fee-for-service platform, and fee schedules are set by the different provinces within Canada. So the payments are different, for example, in British Columbia versus Alberta versus in my home province of Ontario. And essentially, the fee schedules dictate how much a physician will be paid for a particular service. So, for example, seeing a new patient in consultation versus seeing them in follow-up versus doing a joint injection. And each province has varying stipulations or rules, as well as different fee codes that are available to rheumatologists and physicians in general. It's very important to note that the fee amounts that are listed in the schedules do not necessarily mean that is what the rheumatologist is taking home as final pay, because overhead encompasses over 30 to 40% of a rheumatologist's expenses, including rent, heating, electricity, administrative assistance, electronic medical record systems, et cetera, et cetera. So essentially, rheumatologists and most physicians in Canada are running a business where they're a independent contractor for the different provincial governments, and they get paid according to a fee schedule that in turn feeds into their take-home earnings minus expenses.
Thank you for the very comprehensive lay of the land. And I myself, as a patient, sometimes forget because I just show up for my appointment and I don't always think of the back end that has to happen to have the clinic where it is, right? Have my session be this long, right? Have someone retake all of my medical history during my 1 year follow-ups, right? And usually it's a rheumatology nurse, right? So it really makes us think like what is happening in the back end. So the environmental scan that you have completed and that you're presenting at the conference, what would you say are the key messages, some of the key takeaways from your presentation, and how does that impact individuals living with arthritis?
That's a great question. So the motivation behind this study is that we know from previous work that has been done in Ontario and across Canada that access to rheumatology services is very poor. And that means that people who have rheumatic diseases or being worked up for rheumatic disease have to wait a very long time in order to see a rheumatologist. We also know from health services frameworks that a contributor that influences access to care is how rheumatologists are paid.
Yep.
Because from an upstream perspective, it influences let's say, a medical student or internal medicine resident choosing rheumatology as a specialty, doing that extra year of training, and potentially where they practice across the country as well, because as I alluded to, different provinces pay rheumatologists different rates. So we really wanted to do an environmental scan, which is essentially an overview, a review of scientific literature as well as grade literature published by governments to see how how the fee structures are different in the provinces across Canada. And importantly, we also wanted to apply a patient-focused equity lens as well as a rheumatologist-focused equity lens to compare and contrast the differences in not just the rates, but what fees are available to rheumatologists. So I think the take-home message is that there is a very, very wide difference in funding. For example, certain provinces pay rheumatologists more compared to other provinces. And regarding that point, the differences in funding do not seem to be related to need, health system need or patient need. And the greatest example is, I would say, kind of we've been seeing a west to eastward trend in terms of funding, where the western provinces seem to pay the rheumatologists more compared to the eastern provinces across Canada. And the differences are even so marked that there is a vast difference between, for example, New Brunswick and Nova Scotia, where the two provinces are separated by literally a bridge. And what was eye-opening for us is that those changes, again, are not predicated or based upon patient need. And we really wanted to highlight that in our work. For example, a rural rheumatologist in Newfoundland should not be paid differently than a rural rheumatologist in British Columbia. It's not based on health systems or patient needs. We also, our second main point is that the stipulations or rules surrounding the fee codes are at times very arbitrary and not very patient-centered. A great example that I wanted to highlight is the fee codes for intra and interprofessional care as well as virtual care. So most provinces set a limit on what fee codes are paid out for virtual care, whether that be video or telephone, and also have strict rules regarding rheumatologists providing care to adjacent or neighboring provinces. So obviously, that is a major disadvantage for patients who live in more rural or underserviced areas who may in fact prefer virtual care to reap the benefits of having a more convenient location for them to seek care. And also it's a major disadvantage for patients in rural areas of adjacent provinces or territories. If, for example, someone in, let's say, Eastern Winnipeg can't access care to a rheumatologist in Ontario, when in fact that rheumatologist might be closer to them than, for example, going to Winnipeg, which is the major center. And these are just a few of the highlights that I wanted to kind of point out with our interview. And really the next steps are, co-creating solutions with our patient partners, with provincial policymakers, with ministries of health to really align the fee structures to make it more patient-centered and rheumatologist-centered in order to better adapt and service our health system.
I think, really the core of your work is so important because we don't realize that, the work that rheumatologists do to deliver care, the work that scientists do, yourself in your dual role, do to learn about how care is delivered and to prove those systems. We always forget there's a third part in order to put it into or in front of a patient, and that's a policy piece, right? So your work is so, so important because it truly helps one, two, and then that third piece to make that change to then put it in front of the patient. So, so important. I think that segues well into the next question. This year's meeting, or the theme you could say, is ascending to new heights, peaks of innovation in rheumatology. So, Dr. Kwok, how does, your work fit into this theme?
Yeah, so that's a great question again. So I've been very blessed to have collaborators with this work, and our authorship is comprised of rheumatologists, patient partner, and health services researchers across the 10 provinces in Canada. So we also have representation from early career, mid-career, and late career rheumatologists, as well as those practicing in academic and community settings. Our patient partner was also very instrumental in helping us highlight the patient perspective of the equity gap. So I think number one, I think this work is innovative because it hasn't been done before, not just in rheumatology, but in other medical specialties with such a comprehensive look at systemic and regional differences in funding structures. And number two, as you alluded to, it's innovative because it sets the stage for discussions with policymakers. And it is critical that, policymakers, patients at the center of everything, as well as rheumatologists, really come together in kind of a team to look at what has already been done, to highlight gaps on how patient care could be improved and formulate effective change and innovative solutions. So I think the innovation aspect is what this work does, hopefully to set the stage. And I think, outlets such as the Arthritis at Home program and social media, as well as provincial advocacy programs are also very important to hopefully disseminate this work. So then a dialogue can be started to generate these discussions to lead to meaningful change.
So well said. And with that, Dr. Kwok, what we'll do is we'll make sure to gather information and post it below this video so that individuals who are interested, right, in learning more about your work, maybe to writing to their MP about this work, can have access to that information. And I do want to thank you. Like you said, you're doing such incredible, innovative work that I'm so surprised has not been done before, and asking these really important questions and having a multidisciplinary team across Canada that includes patient partners inform this work. So thank you for everything that you're doing for rheumatology.
And thank you for the invitation.
And thank you again for joining us and your time. And with that, we're going to thank Dr. Kwok, and I will say thank you to everyone for joining us today. Please tune in for the next episode of CR Arthritis 2025. And with that, have a great day, everyone. Bye.